there a bathroom?
In the wrong direction, heating up instead of cooling down. We also saw consumer prices earlier this week rising a little bit as well.
In your bathroom?
Yeah.
These reports in particular to see
Thank you.
where we may see some price pressures because of tariffs. In this report, so these are the prices that producers or businesses pay, we have seen some price pressures on inputs or materials used in production, particularly on metals. And so we're seeing rising prices on things like machinery and vehicles, motor vehicle parts, and railroad equipment. So this is the beginning of where some of these tariffs might be playing out for prices.
Oh, yeah, no,
As the president said there, he wants the Federal Reserve Chair Jerome Powell to cut interest rates by an entire point. That is significant. Usually they cut by a quarter of a point. And ultimately the president is saying that we don't see runaway inflation right now, which we don't. The U.S. economy has been incredibly resilient. But we heard from the chair of the Federal Reserve, Jerome Powell, who said that it's too early to tell exactly what is going on with tariffs. And this report really paints that picture. Increasing slightly, tariffs may be having a little bit of an impact, but not enough of an impact yet for them to make any cuts or any increases in those interest rates. Jerome Powell is really in a wait-and-see mode as we get more data in the coming months. Investors on Wall Street believe that this month that the Federal Reserve is going to hold interest rates steady. Maybe within September we'll see a cut if inflation continues to maintain at its same level. But for the Federal Reserve Chair, his base theory is just too early to tell. He's in wait-and-see mode, even though the president wants him to make some cuts.
All right, Vanessa, your favorite reporting for us. Vanessa, thank you very, very much. And to our viewers, thanks very much for joining us this morning. You can keep up with Pamela Brown and me on social media at Will Switzer and at Pamela Brown CNN. I'll see you back here tomorrow morning, 10 a.m. Eastern every weekend morning. Inside Politics with Dana Bash is coming up next, right after a short break.
This is the new Dell AI PC with Intel inside. A PC so ahead of its time, it actually helps you save time. Like literal hours. Because it does all your busy work for you. So you can get busy doing things you actually want to do. And who wouldn't want more time for that?
From Full House to Empty Nest to Free Birds. Hey, what's up, man? Thank God.
We got this.
50 years of helping you invest with every chapter.
Even if your team's been vaccinated in the past, they could still be missing vaccination against certain groups of meningitis. The bacteria can spread through certain everyday behaviors, like sharing lip gloss.
Yeah.
Is your team missing any meningitis vaccinations? Ask their doctor today.
This is a premium.
Yeah, I just need to push it down a bit.
Already known as age for tenderness and treat perfection. This is a med time. Plan a Dad Wants for Father's Day. Visit omahasteaks.com/TV to order the Dad Wants steak package today for just $99.99. And will include 8 additional burgers for free. So get into this. Not this. This. omahasteaks.com/TV today. Because Dad deserves just a little Father's Day visit from Omaha Steaks.
It's odd how, in an instant, things can transform. Slipping out of balance in a free fall. As we navigate a future.
Yeah.
Well, true, you just can't say that. So I can't say, Homestead is the best. No.
What if we jumbled up the words?
Homestead is hometown. No. What if we said it in Spanish?
Homes.com es el mejor.
No.
What if we whispered it?
No. Fine. What if he said,
Homes.com is the best.
Mr. Freeman, I'm sorry, but we can't say it.
Say what?
Homes.com is the best.
Ah,
Homes.com.
it's the best.
You might take something for your heart. You might get support for your joints. Or even use something for your digestion. So why wouldn't you take something for the most important part of you? Your
so much more than
You guys wouldn't have to have a flyer on it.
just
Yeah.
being able to talk
I
about.
need a Leatherman.
That'll work.
There's so much ease with using BetterHelp. Now I feel so much more confident in expressing myself. And that's been a great thing.
Appreciate it.
Yep.
This dance nowadays has been the color show shrubs have been trial and tested with success. It's not just high performance, it's sky-high performance. Unveil garden centers.
How did you work for extra perspectives by me? Comprehensive care, I was getting that in this.
Yeah, I understand the meeting of. I'll ask it for action items in the channel. And Maria already asked for budget reminders. Smart.
I'll buy more. Got it.
Got it, boss. Honor. You got this. I'm Kylie Atwood at the State Department, and this is CNN.
Closed captioning brought to you by Gilt. Visit Gilt.com today for up to 70% off designer brands.
Gilt has the designers like your heart racing. At insider prices, new every day. Hurry, they'll be gone in a flash. Designer sales are up to 70% off. Shop Gilt.com today.
Today on Inside Politics, the D.C. side. Following a showdown on the streets, the halls of Congress, and the federal courthouse as protesters, lawmakers, and top Democratic governors stepped off on the Trump administration's the bus is it bigger vehicle or a bus? With increasing new reactions, President Trump's massive domestic policy bill from the voters who helped put him back in the Oval Office. And disaster in the sky. Officials fear more than 200 criminals dead after a Boeing flight bound for London crashed into a residential area in western India. CNN is tracking all the big developments as investigators rush to determine what went so spectacular. I'm Dana Bashman, so behind the headlines at Inside Politics. Looking at live pictures at Capitol Hill where
Okay, you about to get out of here soon, aren't you?
amid intense questioning from Republicans, of course.
Oh, good.
Policies from
Good,
the
good.
to the White House vision.
You got like 4 o'clock outside.
Protests over President Trump's crackdown expand across the country.
House is in out tomorrow, so I put in, try to get off tomorrow.
Indianapolis,
See what happens.
There's a piece that looks like on the back.
They're out.
Majority of protests are peaceful.
It's right behind the macro, right?
Today, Wisconsin clash between California and the Trump administration goes to the courts. A federal judge will hold a hearing over California's lawsuit challenging the president's decision to deploy national guard for
Today after work.
decision and an announcement that the governor did not CNN News is following this case. So Paula, is that what sparked California's attempt to get this change to in the court is? Are they saying this is not the way it's supposed to happen? If we want national guard troops, we ask.
That's exactly right, Dana, and they are describing this as quoted unprecedented power grab.
That's not
We're
good.
going to see those things play out in court today. Now, as you know,
Where's Texas? That whole team.
we're going to get to see a little bit of this through Zoom. So for those on a full camera in the courtroom, this is a win for some transparency in a federal court hearing that has enormous implications. Now, of course, most people are.
Oh, today? Oh, that's right, right, right.
California governors have an uphill climb here, but they have filed a lawsuit here trying to try to convince this judge that deploying National Guard was against unprecedented.
Well, she got around 4, so you have to go. I do know that she was talking about going to that tournament that starts today. The DMV Live, right? Remember that? The tournament you all, y'all's team is supposed to be. Yeah, and I think the tournament's early too, like those games, because those kids are out of school. So, they're like, they start like at 11 in the morning, 2 o'clock, yeah. Because remember she said that, and you were like, well, I'm not going, maybe Saturday, because you were going to be at work. She's probably at a game right now.
Working fine.
I mean, she may be, I don't know for sure.
Paula, thank you so much. Appreciate that reporting. I'm going here by a
Yeah. All right, man. All right. I'll be up ever since you left.
CNN Paris.
You left from like 4, you left like what, 4:30?
sorry to spring this on you, but Chloe.
Coming up on stage.
Yeah, give me a best
Hey guys. Hey Mike, we've been
ran
there
behind.
we go.
I didn't offend you then, and you
No, no, no,
wanted to come back
yeah.
and say hi.
No, you're
Hi.
fine.
It's like 10 after 6. I gotta be there at
It's
7.
better now. Earlier today we had a couple of things going on that got me a little busy with the Senate Rules Committee, which I can talk about with you and mention how
So that
watch
is
our
my
six
father's
careful about our relationship with
rent.
some of these offices that are
So that's my
necessarily
uncle's race.
you have to deal with, but the gallant Alton, yes. And so
George.
this morning I had to deal with the speaker's office,
she's
who
like
was doing a filming of a tandem with Fox News, and they didn't clear with the Rules Committee, and I got called to kind of do all that, but that's kind of what I do. So
They had it on the
see
on
this
the
relationship.
on the
Rules
Facebook.
Committee for journalists, I forget.
You should get on that.
They said we always have to put on the Senate Rules Committee, and then since the Sergeant at Arms wasn't informed, then
You don't have to.
Sergeant at Arms made a session, I was like, hey, yeah, this happened, but it's on council.
I gotta add you
It's the
to
speaker's office,
this.
let's just leave that alone.
And my cousin
Nothing to do with
also
this.
said,
It's our deals
they
with
didn't
our
feel like
house
they
fires
didn't
today.
get bucks this one right now.
Welcome, glad you're here.
So we had them want to go.
Thursday.
It's Senate Friday.
I don't think so.
Not anymore, we had our moment, it was like, you know, I think Ronnie Jackson was the last incident, Ronnie Jackson.
Go in.
No, Mike and I didn't evolve. Our relationship has evolved for this story, yes. No.
But I think there's been a lot of growth, especially on my side, 20 years now.
No, I didn't when I got home. I didn't see it.
I've been director. And I think, you know, the technology's changed, the way we need to have access, and I guess there's a,
Right. I hear you. I hear you. I have the same concerns.
Yesterday we saw Rand Paul,
I have the same concerns.
Frank was there with his iPhone. But
Yeah.
just, you know, not that long ago, it was all
It's crazy.
ENT cameras. So,
Mom, I told you when I saw it before I left this morning.
The back focus was out. See how it's blurry. So
Yeah, she was shifting.
it's still a focus there. Stop there.
You could tell it was an iPhone, but it was like a. That's crazy.
Better way.
Oh, no.
but that just was too long. And that was his moment, because he
probably already
sure
told her. I don't know, Jay is always old enough that I feel like he would be like, he would not want to lose ENG cameras to show live shots.
somebody has one that
No,
But
no,
in
I'm
any
just
case,
kidding. Like CNN.
So if you do go by house, just check on it. You can still go, still go, I'll be a couple hours right
And
behind.
like a rig, but I mean, like they're shifting their entire like setups to with their camera crews to phones. So it feels like it's just gonna come.
live viewing.
And when I get off, I'm gonna go to Lowe's and pick up that reverse feed.
Yes. Yeah. Yeah.
Somebody asked me a long time ago.
Yeah, I'm gonna look it up right now and see what I'm talking about. It fits in there perfectly and it'll pull that air out of that room.
art of journalism, you know, the LED lights was the tungsten.
Well, because
we had to do it here to try to like soften up the senator's face. You know, when we went to LED, I was like, whoa. Fortunately, the White House had changed their briefing room first.
One right
with
up
LED. So we had these
So
orange
I'm gonna
reality
pull that
projectors.
fan down for you.
So the cameras could
Oh,
kind of
okay, man.
catch up.
Right.
So we finally got to a look in space.
Not so clean spot,
CNN and
spot.
Fox did the look. Predominantly, and the lighting engineers that came in and said,
Okay.
this is how we're gonna make this look. The sound comes from CBS engineer. And then the backdrop is all you. All of this, even, you know, this is, people make fun of our books, but this is a set that we don't use very often, but it has these clothes and we can do a panel interview here. Anyway, and it wasn't that long ago when the news hour used to do like a live hit out of the studio every night with a few senators. But it goes back a little bit. This is all journalism too. And I speak to how we have the technical engineers, how they have the task of technical advisory subcommittee to the gallery that make sure we have the right fiber and the right, you know,
Cover the right decade.
yeah, because you know the centers can like, so the centers will come in and they'll view the space and they want it to look their way.
Sure.
But
We good, or you need to let me keep talking?
one of these, this is Mrs. Lott's blue carpet. That's the one thing they got out of it. But sorry, like go on a while. But there's a world here I think that I don't want to lose, and that is the art of journalism, what you bring to it, and then you know the back and forth that we have, the growth moments. You know, that's secondary. I try to remember that myself. But there's competition. There's the having colleagues, and you know, you can't. We all have an agreement here, but you can't stand over there down in the we're now calling the brickyard over in Russell basement. We're getting some good stuff there. Yeah. But you know,
You good?
the other side of
Yep.
it,
All right, Jeremy.
we are not
Thank you,
able
sir.
to
See you, man.
that wasn't sanctuary cities who Brian Mills was saying, hey, we're over here getting it. If somebody did it, we're not gonna get it. So it's like, but you want those moments, but then shoot,
What?
whatever you're trying to look for yourself. So there's a timeline. Sometimes when I say, hey,
Well, it'll be national because of
because I'm trying to protect my relationships. Yeah, it was sometimes, you know, worried about those communities, such a lot. But most times, I think my promise is
Last night, and this is,
I probably don't need it. Yeah, man, it's not even gonna be blocked, no. You ain't gonna be able to get anywhere in it.
But on the senator rules up, we need to be with that senator in front of us. So that's the other side of it. It's very powerful. As long as we don't
Good for you.
that's
Me too. Yeah. Ride some bikes with my wife. $800 for a bike. Yeah, it's like, it's
Mike,
not
stop
so-
saying bad things about me to my boss.
Good thing, I just said a good
A
thing.
trick?
Yeah, he actually.
That was for me
sounded
first.
like you were
Why are
being-
you so
You
surprised?
were being like a little bit of a narc too.
That's about this thing don't have a motor on it. The one she has. Because she's had it for years.
How there's, you know, there's internal relationships that we try to make sure we have. Well, it's just the last thing on it with the institutional.
I was just asking about any of the.
I'm sorry, I'm trying to get it. There's this new group, and they're going to look at it different. It's not
don't go anywhere.
history of journalism, how we cover the cars. Yeah, this is
Yeah, yeah, they did a good job, man.
What we've changed is our approach, obviously, to is we're gonna cover holidays, we're gonna cover.
Always come going outside against the Capitol White Building.
Yeah. Still nice today, bro. Foundational.
I guess the name of it, man.
Those big giant ones?
600.
Maybe I'm a dinosaur, but I
You
think
probably,
that's
I
the
describe it,
biggest
you
threat
know.
right now.
About that big.
To say it's
just had a
40,000
little
foot view,
light.
but
Yeah,
yeah.
stuff have, the herons would be.
I forget. They're new, they're new.
They're 1,200.
You don't
You
have
bought the
to
1200 till you bought it.
in the Senate.
No, they didn't put the soft boxes. on.
Really?
You know, fight to get
Just
in
the cone?
cameras into conference
the
committees.
Wow.
Because we don't have conference committees anymore.
Seem like they
You know,
could-
we're not waiting on a bill to come out of the committee and which senator in the committee is
Those
gonna
lights
vote.
are so
Down to
bright.
doesn't even- no, everything's a grand deal. And we're in the hallways finding out who's gonna break the deal. Okay, that's one aspect of this job too, and that's what everybody sees us as. But I think what you really worry about
Who was
foundational relationship with the
Oh,
Senate or other committee.
Yeah, man.
As to how we're covering, and then we can't be seats, man, we had the big money, but we gotta,
They were doing stuff outside.
we gotta do something to make sure that the foundation is still solid as tied up. So, in the moment, we have a group, which I got to turn around. There are at least 8 sets up, to narrow it to, it's not just the committees, it's liaison. That the meetings have been with certain officers and many of the state. Sometimes what we do in the hallways is, changed and inflated and, so I. That doesn't answer your question.
Yeah, no, absolutely.
As far as everything else. Thanks to all the, no,
We'll keep it interesting.
I'm glad you're here and welcome.
Thank you.
The door's always open, not too often the DOT's coming to me. It's his fault. Frank set this up. I want to thank you for that.
Yeah, it's right.
He did.
What is that?
But his name.
Oh, yes.
I get it.
Not
Nice
sure.
to see you. Thanks so much. We're around. I know. The retreat to the Bureau.
Good luck. Yep, see you. Okay. The trouble. I hope not, yeah. All right, how we doing, Jeremy? Matt was worried about the sound or audio. Audio's good? Okay.
Yeah, he did, 12:30.
I'm gonna do a survey in here one of these days soon.
What do you got?
The audio goes back to 2008.
Mm-hmm.
And so we've kept it going. We put in, we had trouble on, I think, mic level, so we switched to line level.
Okay, and this
And now
is.
even that, I'm understanding. Depends on.
Oh, okay.
Output. Yeah, sometimes it will jump, so I just kind of went to the next best option.
All right.
Got it figured out, so.
I'm going to do something. It won't be soon, but to get our sound tech.
Oh, yes, how you doing? Good,
Do a survey.
good,
I know which-
afternoon.
Maltz is working, which one isn't.
Yeah.
All right.
Much appreciated. Oh, Mike, this is a card. I don't know if you had a chance
Carter?
to speak.
Mike.
Full out. Once I lose it. Here till
Thank you, I appreciate you checking.
Instead of judged. See, what do you have a better idea?
He's just like, you can look at this and tell.
No evidence that that happened in the state, so the Basque aircraft was taken off with what appears to be not a proper takeoff configuration, which is very, there's all kinds of systems and checks and balances and warnings that indicate that is not the case to the truth.
And I do want to ask you about this is a Dreamliner model, has a pristine safety record for the secret. But this is another long track. The average person is going to hear that and think, okay, what does this mean? I want to emphasize, I know we know that we don't have a black box, but so many variables. But that isn't the natural instinct for people to have.
What about the other part? And the one that's in, is that Temple Hills? You know what I'm talking? Yeah. Temple Hills on Temple Hills Road, I thought so. That's been there for a long, long time, like that pool area. Yeah, okay. So would it be the Temple Hills Recreation Aquatic Center? The name of it? Oh, I thought there was one that had a pool. Hey, that's the one I'm thinking about. 'Cause I think the ones that have the pool are the ones. Well, not necessarily, no. For your staff, yeah, okay, okay, fantastic, so I can try Temple Hills or Allentown and see if they do it there. If not, you gotta try to do the Red Cross, wherever it is. Okay. Yeah, because I remember. Yeah, okay. It's worth a try. Yeah, it's worth calling. You never know. That's your ass. Okay, thank you. Okay.
Hey, how are you? Hi.
No,
Nice
no.
to meet you. Matt. Nice to meet you.
I'm Tracy. I think we've met before.
Tracy.
Are you the first EC meeting?
Yes.
That's your we're really good to be able to. Are you still doing that?
Still doing it for now. Yeah. It's a couple of events that have gone all right. So.
I must be emails.
Oh, you have it? Okay. So we've had a couple of
MSNBC dad, so.
I never had a CNN house, but my dad is celebrity famous.
My parents stopped watching CNN.
I know, mine's don't either.
My,
My mom's like,
I have to
all
keep,
they want to do is have
I have to keep a,
My dad just likes the non-news hours. MSNBC.
My parents watch a lot of local news and a lot of ABC news. David, David Weaver?
get you over there. Because it goes back around that 400.
When
All right.
you think of a new prescription at the pharmacy, you don't know what they're going to cost. That's why I always recommend you check single cash before you get them. Single care is saving millions of Americans money on their prescriptions each day.
I wanted to thank you, by the way, yesterday. Vegas, I realized, especially Vegas, was very, very happy with you. And she benefits from being seen on TV at home too. But, no, obviously. Oh, nice.
Or actually, you can do see what looks better on the phone and then decide.
Can I go a little more central, you think?
Sure. Go ahead. Do you know how long before I shoot it? Okay. You want me to look up May and she can do my color? Thank you. That's the one that.
Inconsistent with logic.
Thank you all for joining us. I thank my colleagues. We're going to talk about the big, bad House health bill that amounts to the largest health care cut in American history. And our colleagues don't want to talk about it. They don't want to have a markup in the Finance Committee. They're doing everything they can to hide the ball because this is a bad deal for their constituents. The fact of the matter is Democrats want to make it easier for Americans to get health care rather than to put people who desperately need health care through bureaucratic water torture if they're going to get the health care they need. So we've got a number of our Senate leaders who are introducing important bills to strengthen Medicaid, to strengthen the health care system. And these bills are all about making Medicaid work better for moms and kids and seniors and American families. I'm going to be very brief and highlight two proposals that are particularly important to me. The first is about rural hospitals and labor and delivery. I had a front row seat to this a couple of years ago in eastern Oregon, where St. Alphonsus in Baker City just said, we're leaving, we're pulling out after being there for decades and decades, and it would have meant that the next closest birthing center would be 45 miles away on a road that would be incredibly, treacherous, and the experience is not unique to Eastern Oregon. These maternity deserts are developing all across the country. So I've introduced legislation with Senator Hassan. We're offering stability to rural hospitals to prevent their communities from becoming these deserts. And we also protect against big regional or national chains swooping in to take the money and run instead of investing it in the communities that desperately need this service. One other area that is particularly important, I am proposing with Senator Cortez Masto, and that's an effort to fund the fraud fighters on the beat. I'll let the senator expand on the thought, but the benefits are plain to see. For every dollar that you invest in fighting fraud, you get $11 returned to the Treasury. That is a hell of a good rate of return on investment. And I think that's a no-brainer, and I think the colleagues that are here today are going to outline similar policies that strengthen Medicaid and fight fraud rather than rip away health care from American families. So we're going to have colleagues voting, and it's going to be a little hectic. Let's go with Senator Whitehouse.
Thanks very much, Chairman. It's great to be here with Chris and Ben Ray and our finance chair to announce this package of bills that will actually improve Medicaid and Medicare instead of attacking Medicaid and Medicare. In Rhode Island, a third of our population nearly is covered by Medicaid. A half of our births nearly are covered by Medicaid, and about 2/3 of our nursing home patients are covered by Medicaid. So this is a really savage hit that is being proposed. They may try to make the date when individuals get hit go out past the election, but what they can't change is the effect on hospitals and the effect on nursing homes when they look forward to their future budgets and realize they're going to have to start planning for things like receivership. And that will be now, because responsible planning means knowing what your revenues are going to be in the future. I'll close by adding that there is also a secret shot in this bill being taken at Medicare. The amount of borrowing that they have to do to fund the creepy tax cuts for their creepy billionaire donors triggers something called sequestration, which is an automatic across-the-board cut to Medicare, $500 billion over 10 years. Don't pretend they don't know about this. They just didn't fix it. If you look at the House bill, there is no waiver of sequestration. The shot at Medicare is already in this bill. So everything that we are saying about Medicaid and the destruction that this bill will do in regular families' lives is made worse by the cheap shot they're taking at Medicare through sequestration. Chris.
All right. Well, thank you, Sheldon, and it's great to be here with my colleagues. Let me thank Senator Wyden for all the work he's doing as the ranking member on the Finance Committee. To Senator Lujan and Senator Whitehouse, thank you all. And we're here for those two reasons. One is to shine a spotlight on the great damage and harm the Trump Republican plan will do, but also to put forward some ideas about what we could be doing to actually make health care better for more Americans. With respect to the Trump Republican bill, the president likes to call it his big, beautiful bill. It is a big bill. It's beautiful if you're a billionaire or a very wealthy person. For everybody else, this is an ugly mess, and it comes at the expense of everybody else in America. And that's especially true when it comes to attacking health care for tens and tens of millions of Americans. In fact, it will kick 16 million Americans off of their health insurance plans. That includes 230,000 Marylanders. Nursing homes will have to lay off nurses, the people that we depend on to care for loved ones. People will be forced to go without doctors and health care. And again, all to finance a tax cut for very wealthy people, which even after they do this great damage, will add over $3 trillion to our national debt over the next 10 years. One of the things they do is to create more red tape and bureaucratic hurdles and put that in the way of people who are seeking Medicaid. Let me be really clear. This is not about attacking fraud, waste, and abuse. We've put forward proposals that actually go after waste, fraud, and abuse. This is actually about creating more paperwork hurdles for people who are eligible for Medicaid. In many cases, most cases, people who are working. But if you require someone who's literally working paycheck to paycheck to have to fill out huge forms every couple weeks, that's red tape. That's bureaucracy. I thought that they were in favor of making the government more efficient. In fact, what they want to do is make the government less efficient to deny eligible Americans access to health care. So what should we do instead? We should make it easier for eligible individuals to get the Medicaid that they are eligible for. And that's the bill that I've introduced. We're reintroducing it today. It essentially helps, it's the easy enrollment bill, okay? And it's modeled after something we did in my state of Maryland, which is somebody figured out that if, as part of your state tax return, all you have to do is check a box, and the state will then help determine, based on your income, whether or not you're eligible, and send you a list of options as to the plans that you're eligible for, and you can sign up. The result has been 14,000 Marylanders who were eligible for Medicaid, but just couldn't go through all the bureaucratic hurdles that already exist, are now getting the health care that they need and that they're eligible for. So we should do that nationally. 9 other states have followed Maryland's lead to do that. We should do it at the federal level. All you have to do is put on your federal tax return a checkoff that, again, says, check to see if I'm eligible. And we can do that. And as a result, millions of Americans who right now are unable to access health care because of bureaucracy and red tape, we do actually make it easier. We do what they claim that they want to do when, in fact, they're doing the opposite. So I hope everybody will support the Easy Enrollment in Healthcare Act. That's something we could actually really do to help people who need health care the most, rather than give a big tax break to billionaires. And let me turn it over.
Thank you, Senator Van Hollen. And nobody has done more to help the fraud fighters on the beat than the senator from Nevada, Senator Moss.
Thank you. Senator Wyden, thank you so much for pulling this together in this discussion, but the work that you do in Senate Finance to really fight for and support hardworking Americans and our small businesses and so many others. Listen, there's no doubt. They're taking away health care. There's no doubt. In this reconciliation bill, they're taking away health care. I just came from a hearing in Senate Finance with Secretary Bessent. The reconciliation bill, the CBO, it's $2.4 trillion deficit. Their answer is, well, the tariffs are raising enough money to cover that deficit. But it's a double whammy for middle class, because they're paying for those tariffs, their taxes, and the small businesses are paying for those tariffs, their taxes. And then this reconciliation bill takes away their health care, takes away essential programs and food assistance. Now, here's one thing that I've always heard my colleagues say. Well, we're doing a lot of this right now because there's too many people that are gaming the system, and there's a lot of fraud, waste, and abuse, particularly in Medicaid. Well, let me tell you, I know a little bit about it. As Attorney General for 8 years, the Medicaid fraud unit was in my office. I had investigators, I had attorneys. We focused on Medicaid fraud. And I will tell you, there is not enough Medicaid fraud that is going to cover the deficit they are claiming it will. There just is not enough. I'm all for going after the waste, fraud, and abuse. I think we all are. What we should be doing, and this is why I've introduced this legislation with the Chair of Finance and many of my colleagues, is provide more funding for those Medicaid fraud units across the country. Every state has one. Let's give them more funding so that they can pursue more investigations, more prosecutions for that investigation, for that fraud that is happening in Medicaid. Because I know, at least the unit that I ran as Attorney General, that money was put back into the Medicaid program and the Medicare Trust Fund so that more people can get advantage in health care in this country. That's what it's about. So the legislation we are introducing does just that. Working with our Medicaid fraud control units across the country, we are working with them to figure out, as we look at additional funding to bump up those programs, what it is they need to access the investigations, the prosecutions that will return more dollars because of that waste, fraud, and abuse that's across the country when it comes to Medicaid. But does not cover a $2.4 trillion deficit. That is not the case. There's easy ways to do this. We can do both. We can address that waste, fraud, and abuse working together and still make sure that the middle class, small businesses, hardworking Americans can have access to health care. Why does it have to be an either or? It's not a choice that any small business, it's not a choice that any working hard class American should have to make.
I thank my colleague. Nobody on the Finance Committee does a better job of trying to pin down cabinet members who are trying to duck and bob and weave, and we saw it a little bit. Senator Lujan to describe his efforts.
Thank you, Mr. Chairman. I appreciate that, Ron. It's good to see all of you here. I was also in that hearing with Secretary Bessent recently, just moments ago. And it sure would be nice if some of the cabinet secretaries under this president, when they come to answer questions, if they would just tell the truth. You know, this big, beautiful bill, as they call it, it's a betrayal. And what we heard today was a big, beautiful lie as part of the cover-up. This notion that this bill does not go after Medicaid, does not go after Medicare, does not go after nutrition programs, it's going to hurt folks across the country. Now, this week we had advocates for loved ones with Alzheimer's and dementia come to Capitol Hill. I'm wearing a pin that they shared with a lot of us for folks that fight and care for loved ones that are fighting Alzheimer's and dementia. And the legislation that I'm introducing, it's real simple. It's the Home and Community-Based Services Relief Act. The idea here is to make sure that there's more support for families to take care of loved ones. Right now, the devastation coming from Republicans is going right after folks that are the most vulnerable in the country. And they're just telling folks, family members that take care of other family members, sorry, you're just on your own. We're going to throw everyone out on the street, and there's nothing for you. It's not right. When I was young, I was very fortunate that we moved in with our grandparents, and they moved in with us. I was born and raised in a family where we took care of one another wherever we could. People across America are scared. And that's why I'm proud to introduce a piece of legislation that will provide them some support, some certainty. This is something that Democrats and Republicans should be able to support. But in the face of Republicans tearing apart these programs that families depend on every day, we need to show them who's on their side. Be honest with the American people, help them prepare, but let's make sure that we take care of our loved ones as well, no matter where they live in America. I'm proud to introduce the HCBS Relief Act with many of my colleagues, and God willing, this thing will pass. Ron?
I thank my colleague. We'll throw it open to questions for any of us. Yes.
Sure. I mean, you guys don't want this reconciliation bill to pass, and some of these proposals seem like they might be bipartisan. So two things. Do you think you might actually sway a couple of Republicans away from reconciliation? And number two, if you can't, does any of this survive? Does any of it go through? Or you try to work on some of it later?
I'll let my colleagues chime in on it. I mean, we have always been a bipartisan group. For example, this is a group that worked to produce a 26-0 vote on PBMs. You know, where basically you had seniors and small businesses getting ripped off. What happened? Donald Trump came in at the last minute and took the win away. So this is a group that always wants to be bipartisan, will always work with people who want to do the right thing. But they haven't been interested in doing anything bipartisan on this. This has been partisan from the get-go. Colleagues, anything you'd like to add? Keep going.
He said it.
Yeah.
He covered it.
There are Republicans who acknowledge that there will be losses, but say that it's because the people who are choosing not to work, choosing not to be in educational programs, or people who don't have legal status who are indirectly cut off for the CBO's projection. Is there a difference in kind of what you're counting as a cut and what Republicans are? Like, is there an, I feel like there's almost like a semantics issue here, where we're acknowledging that there are going to be losses in terms of the actual number of people covered, but characterizing them in very different ways.
Well, I'm someone who
Let me
just heard
say,
this, and I'm happy to.
There's a narrative that Republicans who are constantly opposed to Medicaid have been offering for years, that Medicaid is riddled with fraud, that people who should be working aren't working, and they're on the couch goofing off and sucking up the taxpayer dollar, and this program encourages that. Well, just the problem is that none of that is true. Like Senator Cortez Masto, I was an attorney general. We had a Medicaid fraud control unit in my office. That kind of stuff somebody figures out pretty quickly, and you go and do something about it. They said the same thing about the child tax credit, that if we let the child tax credit continue, that would encourage families to just lie around on the couch and soak up the taxpayer child tax credit. And what we actually saw in real life was the exact opposite. The child tax credit supported families getting child care for their kids so they could go out and find work. It had the exact opposite effect. So you have to take this Republican phony narrative about undeserving people on these benefit programs with a huge, huge grain of salt.
Only thing I'd add, because I was struck, being home and I heard the speaker and others talk about it, the federal government does not pay for health coverage for undocumented immigrants. And if you listen to what they've said on the House, they completely make it up. They say the federal government is. The reality is it is not, period. Any other questions? We'll stick around and visit with folks. My colleagues have some important bills. Follow them.
Thank you all. Thanks for being here.
Thank you, guys.
Thanks, Ron.
Yeah, I mean, basically, the speaker said point blank.
We can do this again tomorrow?
No.
I assume she's flying home tonight. Are they in tomorrow?
Yeah, I don't know. I don't know what her schedule's looking like.
Well, do you have to wear a suit to work tomorrow, or can you
No,
dress kid?
but
Doesn't that kind of answer it? I'll see you.